Dr. Michael McClelland is a graduate of the University of Texas Medical School at Galveston. After receiving his medical degree, he completed his residency at the University of Kansas Medical Center in Kansas City, Kansas. Dr. McClelland treats patients in all aspects of general urology, but has special interests in urologic oncology and specializes in Peyronie's disease, kidney stones, minimally invasive therapies for the treatment of BPH or enlarged prostate, laparoscopic surgery, and performing vasectomies. Along with his practice, Dr. McClelland served as Chief of Urology for Seton Medical Centers and is involved with other medical-related boards in Central Texas. We have a lot of great content to cover tonight, so Dr. McClelland, I'm going to turn it over to you to get us started.
Thank you very much. Appreciate everybody's time this evening. I know everybody's time is valuable. I've done these a few times before, and I found that we'll go through the slides relatively quickly and then get to everybody's questions, and hopefully everybody will get everything they need out of this. And so with that, kind of as a brief overview, we're going to initially talk about the prostate, we'll talk about BPH in general, and then we'll talk about some treatment options available, and especially focus on the Rezūm Water Vapor Therapy treatments. Next slide. So the first question is, what is the prostate? Prostate is a walnut-sized gland at the base of the bladder. It surrounds the urethra. It produces fluid for ejaculation and is essentially a reproductive organ. It is a organ that will start to grow when people get in their 40s and 50s. 50% of men over 50 will have some sort of prostatic growth that will start to cause obstruction and therefore benign prostatic hyperplasia or BPH. Next slide. What can happen to the prostate? These are three main things that we deal with in urology. One is obviously BPH, prostate. We're going to talk about prostatic hyperplasia tonight, not prostatitis or prostate cancer. Next slide. What is BPH? BPH is commonly known as enlarged prostate. The normal prostate is approximately 1.5 centimeters in diameter. Benign prostatic enlargement can lead to bladder outlet obstruction, which can lead to bladder outlet obstruction symptoms such as frequency and urgency. The obstructive aspect of BPH usually leads to people not emptying their bladder as well, frequency of urination, and decreased streams when they do urinate. Next slide. BPH's relation to prostate cancer. We already talked about this a little bit. BPH is not prostate cancer. BPH does not cause prostate cancer. BPH symptoms are similar in severe cases of prostate cancer, but most prostate cancer patients are cases people are completely asymptomatic. And the way we're going to find most prostate cancer patients is through PSAs. All men over 50 years of age should be getting a PSA on an annual basis and having a digital rectal exam by their primary care doctor or their urologist. Next slide. Normal versus enlarged prostate. As the prostate grows, pressure can be put on the urethra. This pressure then can cause the obstructive symptoms that I was talking about earlier. Not all prostates that are enlarged cause obstruction, and not all obstructing prostates are large, but the majority of the time, an enlarged prostate is what causes obstruction. What are the symptoms of BPH? We went over this a little bit already. Frequency of urination, both ACA and override bladder type symptoms where you feel like you need to go right away. Burning and painful urination can be, that'll also sometimes be a signal of an infection. Weak flow, not emptying your bladder, and a complete inability to urinate. Those are obviously obstructive issues. When it gets bad enough to the point that somebody's not able to urinate, then that's usually going to require a Foley catheter to temporize and get the patient through so that they can see their urologist. Many men who suffer BPH may experience a reduction in quality of life. These are some stats that talk about how men tolerate this. Studies essentially show that people who have problems with BPH have sexual issues. They're unhappy with how they sleep. Their lack of sleep can interfere with their daily lives. 51% of men say BPH interferes with their normal life and quality of life. BPH also affects a man's daily routines and relationships, and those are all based on some studies that we'll be happy to share with you if you'd like. Who can get BPH? BPH is most commonly found in men over 50. It affects 50% of men after age 60. As I said before, people will usually start to have mild symptoms in their 50s, and as people get older, then their symptoms will get worse. 90% of men who get to be age 85 will have some sort of benign prostatic obstruction. In 2010, as many as 14 million men in the United States had lower urinary tract symptoms. Obesity, higher body mass index, and lack of exercise may increase the risk of BPH as well. I'm sorry, the slides are not, I don't know if everybody can still hear me.
Let's see.
There we go.
Okay, perfect. Sorry about that, guys.
Perfect. Sorry about that, guys. So we have, just so everybody knows, we've had some internet issues this evening. I apologize for that. And so if we have any more pauses like that, please just bear with us. How is an enlarged prostate diagnosed? Medical history and physical exam. We're going to do a digital rectal exam on patients. We're going to check their urinary output, and that can be done a number of different ways. Bladder ultrasounds will frequently be done as well to see how well somebody is emptying their bladder. There's also self-examination symptoms. There's an AUA symptom score and an international IPSS score. Those are both helpful in letting your urologist know how bad your symptoms really are. Next slide. Treatment options. Now let's talk about why we're really here. So initially, when people start to have symptoms, they start to have behavior modification. Usually they'll drink less in the evenings. They'll start to cut back on caffeine or alcohol, things that may make their urination worse. After people get frustrated enough with it, us men are usually not very good at going to their doctors initially about problems like this. And when they do, then usually the first thing that people are going to do is start with something called an alpha blocker, which is a BPH medication. Some people really don't want to have a lifelong medication, and that's where procedures like Rezūm Water Vapor Therapy treatments and some of the other implants that are out there are good options. I usually lean towards it works better. Surgical options. Surgical options are vaporization procedures such as the green light laser, plasma button, and so forth. There's also the TURP, and then there's also a type of prostatectomy called a suprapubic prostatectomy that's really not done very much. And then there's some other newer technologies that are emerging. This is a fascinating field, and that something new seems to come out to treat BPH about every 3 to 5 years, which has been really fun. Next slide. No dietary supplement is really effective. I can't tell you how many patients come in trying sulfameto and other things, and there is a high degree of a placebo effect with anything that people take in the urology space. It's been fascinating to see. There's lots of studies to show this. There certainly are some people who say that they take supplements and they do well. Fantastic. Keep taking it. But in general, studies do not back up the use of Sulfameto or other supplements. Watchful waiting, that's essentially where people don't do anything yet. Frequently men in this category will go ahead and decrease their fluid intake at night so that they hopefully get up a little less often. But in general, it's a man who knows they have some problems, but they don't want to do anything yet. Next slide. Alpha blockers, we talked about this a little bit. This is usually going to be the first line therapy that either a primary care doctor and or a urologist will give a patient. The most common ones are Flomax, also called tamsulosin, or alfuzosin, also called uroxetrol. These can rarely have blood pressure drops and cause dizziness. If they do that, it's usually going to be in the first couple of days, and usually will get used. Next slide. I am not. Next slide.
Are you seeing the 5-alpha reductase?
I am. So 5-alpha reductase just came up. There we go. Sorry about that again, everybody. So 5-alpha reductase inhibitors. These are something that this would usually be the second line therapy to shrink the prostate. I personally use these a lot less since I've been doing Rezūms. I've gotten to the point that if the alpha blockers are not working, then usually my next step is to go to a minimally invasive procedure rather than add more medications. But 5-alpha reductase inhibitors certainly are an option. They have about a 15% chance of decreased sexual drive and or ability, and can be associated with ejaculatory dysfunction, breast enlargement, and breast tenderness. Next slide. Rezūm Water Vapor Therapy. This is usually my second option after an alpha blocker. The Rezūm procedure, I've been doing it for, I think, around 5 years. Abraham, correct me if I'm wrong on that. And we've done a couple hundred of these here in Austin through our practice, and it really has turned out to be a fantastic procedure. My background is that I started even back in residency doing some minimally invasive procedures that really didn't end up working very well, and then started working with some of the lasers and then some of the different therapies to clean out the prostate, and then actually went to doing the urolifts, which are the implants where you open up the prostate, and I found that those just weren't working as well as I wanted them to. And with that, switched over to doing Rezūm as my next line therapy. And I found that the Rezūm is great in that what it does is pulls tissue up that symptom gets significantly better. And I tell people this all the time, people aren't going to like us urologists very much for the first couple of weeks to a month or so after the procedure. And it's because we're killing this tissue. While we're killing this tissue and while that tissue is healing, people are going to have to go frequently, urgently. It's usually not very painful, but they're going to have to go more frequently and urgently while the healing process is happening. At about 4 weeks, a patient will come in, and usually they're doing as well as they were when they came in initially, but they'll have a much better stream. We'll frequently be able to get them off their medications, and then week by week they get significantly better to the point that 2 to 3 months after the procedure, people are usually very, very happy with how they're doing after the Rezūm. This 4.4 surgical retreatment rate, I think that's about right. We looked at the first 100 that I did in my practice, and I had 6 of those that I had to operate on. In retrospect, when looking back at those, probably 2 of those probably are guys that I would not have considered them to be as good a candidate, and probably would have done a different procedure. Next slide. Rezūm Water Vapor Therapy. Here's a video.
Rezūm Water Vapor Therapy is a non-surgical treatment for BPH. Rezūm uses the natural energy found in steam to shrink the prostate. In just seconds, this precise technology destroys enlarged prostate tissue while minimizing any effect on surrounding tissue. Rezūm is a potential alternative to drug therapy, permanent implants, and surgery. It preserves sexual and urinary functions, and it's clinically proven to safely and effectively reduce BPH symptoms. Potential side effects include painful urination, blood in the urine or semen, pelvic pain, and urinary frequency, retention, or urgency. The procedure is performed right in your doctor's office or outpatient center. You do not need general anesthesia for the procedure, and Rezūm therapy lets you quickly return to normal activities. Talk to your doctor about Rezūm if you're no longer comfortable with your BPH symptoms. Drug therapy isn't working for you. The side effects from drugs are impacting your quality of life, or you don't want to have surgery or get an implant.
So with that, this is another quick video. A couple things on that video. Number one, if you do have questions, go to rezūm.com. There's a lot of this is on there. If you're here in Austin, then feel free to call and make an appointment. We'll be more than happy to sit down and talk to you about your options and see if you're a good candidate for something like this. 97% of patients would recommend Rezūms to a friend. I would tell you that a lot of my patients that I end up operating or doing Rezūm procedures on, they are self-referrals, which are my favorite types of referrals. That means people think that that what we did was helpful and went well. And so here's a testimonial video.
I found out that I had BPH. My symptoms were a slow stream, and I would wake up frequently in the middle of the night. I first heard of Rezūm when I was researching enlarged prostate and the procedures to repair it, to fix it. And Rezūm was one of them. The more I researched Rezūm, it was the latest and greatest technology, and I want to be part of new technology. I think technology is good. My experience with the Rezūm procedure was very good. After the procedure, I was a little worn, a little tired, and the next day I felt fairly good and was able to get up and get around.
Since Joe's Rezūm procedure, we're able to spend much more quality time together, fewer interruptions, and we're just happier as a couple. The Rezūm treatment has made a very big difference in our life.
All right, so the prostatic urethral lift, this is the implant that they've been referring to in the last couple of slides. Like I said, I did about 30 to 50 of these, and I just didn't find that my patients were doing as well as I wanted them to. Some of my patients did great. Actually, I did one of these on my nurse's husband, and he's still doing fantastic. But I had a number of patients who didn't do as well as I wanted them to. This is certainly a surgeon's choice, though. There are a lot of people that think that this is a fantastic procedure, and so I would encourage you to talk to your urologist about what they think is best for you. Next slide. Green light laser therapy. This is falls into kind of a whole topic of vaporization of the prostate rather than resection of the prostate. Lasers were some of the first things. There was a lower watt green light laser, and then there were multiple other lasers that came out. Now the green lights are much more powerful than they used to be. And there's also the plasma button technology. All of these really do the same thing in a little bit different way to open up the prostate and again make it so that people are able to urinate better. The big thing with the green light or any type of transurethral vaporization of the prostate, this is a surgical procedure, whereas the Rezūm is done in the office without having to be put to sleep. Next slide. So this is a video essentially showing the green light being used for a vaporization procedure. The key to this is that in the top where it says before up there, you see the obstructed tissue, and in the bottom, that's what we really want to see afterwards. Is we want to see that whether you're using a green light or whether you're using whatever technology to open up the prostate, that's exactly what it does. That you go from having obstructing tissue, whether it be lateral lobes like they're showing here, or a median lobe, things like the green light laser and the bipolar technology are able to nicely get the prostate open and get rid of the obstruction. And by getting rid of that obstruction, it again makes it so that people will be able to urinate better. The downside to having any of the surgical procedures is that their symptoms will get worse before they get better. Again, it goes along with the healing process that we talked about with the Rezūm. And so whenever people have whatever procedures done, there's going to be inflammation of the prostate. That inflammation of the prostate, while everything's healing, is going to lead to increased frequency and urgency. But frequently, after people get over that healing process, that's when people are really happy and come in and are very thankful that they had the procedure done. Next slide.
Can you see the TURP slide, Dr. McClelland?
There we go. Sorry again, we got a little delay here. So transurethral resection of the prostate is the TURP. This is kind of the gold standard procedure. This is the procedure that was done for many, many years until some of these newer technologies came out. TURPs are still done. TURPs are usually done with bipolar technology now rather than monopolar technology, which decreases bleeding and also allows us to be able to operate in a less bloody field. These certainly are operations. We go in and we essentially scrape out the inside part of the prostate. TURPs are done a lot less often nowadays than they used to be. People who are good candidates for TURPs are people who are in retention and want to get their catheter out sooner than later. People who have prostates that are a little bit too large to do another procedure on, or people who we need to get some pathology because we're worried about them from a cancer standpoint. And so those are patients that we're going to do TURPs on. TURPs can frequently be done in surgery centers on an outpatient basis. Some people still will need to have them done in a hospital and stay overnight at least one night. Next slide. Prostatectomy. So this is kind of a complex topic. Usually when you hear prostatectomy, you're talking about prostate cancer. What they're really talking about here is something called a suprapubic prostatectomy. And there are two ways to do that. That's an open procedure or there's a robotic procedure. This is not done nearly as often as it used to be. Next slide. I'm still on the prostatectomy one. There we go.
Yeah.
Insurance coverage. There we go. This is the responsibility of the patient. So, and to be honest, this is usually something our offices are going to take care of. And then somebody will usually call and let you know what's going to happen from an insurance standpoint. Summary, there's multiple different options. The big takeaway from this is with these different options, you really need to sit down and talk to your urologist openly and honestly about how much your symptoms bother you, what symptoms you have, and what you want to go through. And what I tell people all the time is, you'll let me know when you're ready to have something done. And when a patient's ready to have something done, then we'll sit down and figure out what the best procedure for them is. The usual workup to see if somebody needs a procedure is going to be some sort of urine flow test, a PSA, and a cystoscopy where we look into the bladder and see what type of obstruction they have, make sure it really is coming from their prostate and there's not something else going on. And then we'll sit down and have a more significant conversation about what the best options are for them. Next slide. Next steps, we've already talked about this. If you have problems, if you're interested in having further discussions, feel free to give us a call or give your urologist a call. And interestingly enough, there's our phone number. So feel free to call us if there's a number of us urologists with Urology Austin that do Rezūm therapy. And again, 512-477-5600.